When applying PRP for hair loss, is there evidence regarding whether it is better to use injection or microneedling? When applying PRP for hair loss, is there evidence regarding whether it is better to use injection or microneedling? I noticed that some doctors advertise both, and some only one or the other.
Thank you for your question. You submitted a question without a photo, but you're asking essentially a question trying to figure out what's the best method of delivery of PRP. You're asking, is there evidence to support whether it's better to do PRP with microneedling or PRP with injection? Well, certainly I can share with you my perspective on both of these methods as well as the application of PRP for hair loss in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a technology we developed in our practice which does use PRP in addition to acellular matrix and other ingredients that we developed over the course of several years. And it is a non-surgical solution for hair loss. So I can tell you how I made these determinations in the development of this treatment, which I feel, in my experience, is actually much more effective than PRP, whether it's microneedled or injected. And I'll explain why. So to begin with, let's understand a little bit of what is the rationale behind these methods. Back in 2007, an article was published in Nature by a famous, well-respected dermatologist researcher about an injury model on mice that resulted in new hair formation. And so the concept was that if a particular biochemical pathway is manipulated, you can actually create hair. And the understanding is that when skin is injured, it can generate the new skin, which originates from hair follicles, or it is often observed with microneedling that you can get very fine hair. In fact, we've had patients come to us who told us that they would routinely microneedle their scalp and they would feel this very fine fuzz of hair growth. The problem is that fine fuzz is as far as it goes. This is the type of hair known as vellus hair. And vellus hair is often referred to as like lanugo hair, or hair that is fine. And when we say that our bodies are covered by fine hair, that's exactly it. You can't really see it. But if you use a microscope, you can actually see it. In order for that hair to continuously keep growing as a response to injury, you have to keep microneedling. So certainly when we were developing hair regeneration, and a little bit of background of hair regeneration, essentially we were doing hair transplants, several a week, including amongst all the other cosmetic surgeries I performed. And we noticed that periodically when we were using PRP with acellular matrix to help the wound healing of the donor area and the hair grafts that were transplanted, thinning hair became thicker. So what I decided to do was develop a strategy to see if, independent of hair transplant, an injection using PRP, using acellular matrix, and briefly acellular matrix is referred to something called extracellular matrix derived from pig bladder, that is essentially stimulates healing by duplication of cells in the injured tissue. So when you place it on muscle, you're able to grow muscle. When we are placing it for skin, we're able to accelerate the healing process of skin. So I use it a lot on my facelift incisions and reconstructive procedures and grafts, that including skin grafts and tissue grafts, and I was really impressed with this material. Ultimately, during the development, I was also thinking about the wound healing technology that this material was originally used for, and came up with different methods of using microneedling. And we found that microneedling has a role, but for the treatment of an individual patient, we don't use it consistently for everybody. I actually developed an algorithm, which is the basis of our company, TrichoStem Hair Regeneration, so that dosing, method of delivery, factors that have to do with the person's age, age of onset of hair loss, progression, gender, various other factors that go into how I dose and deliver, I use microneedling on very specific indications. Microneedling also is adjustable. It can be mild, which is like 0.5 millimeter, or it can be deep, like 2.5 millimeters. So you have to think about why does the doctor see a benefit in microneedling versus injection. In our practice, when we do hair regeneration treatment, we use an injection as a given in pretty much every patient we treat. And it's an injection using PRP, acellular matrix, vitamin D, placed in a very specific way. And we occasionally do microneedling as part of this procedure. But in my opinion, delivering the active ingredients that are necessary for the hair follicle to function, and just to go over that element, what we're doing with hair regeneration is we're stopping progression. We're inducing the shed of thinning hair, and we're inducing the regrowth of hair that's not growing. Now, PRP does induce regrowth, but it doesn't induce sustainable regrowth, in my experience. What I have found is that PRP, which we use in our practice for everything, including under-eye dark circles, for acne scars, for fine lines and wrinkles, is remarkable material, but it cannot stop the progression of hair loss, and often people need to go for consistent treatments, once a month to once to every 3 months. Certainly there's a lot of different protocols that colleagues have developed that they're comfortable with. But in our practice, when we do this injection treatment, people do not need that type of a schedule. We'll do a treatment at a single point, and then in certain select patients, we'll do another treatment at around 15 months. We have data that for over 5 years, people have not had regression from a treatment that was done at a single time, or with a second treatment is 15 months later, which we refer to as a booster. That being said, I think that if you had to choose between PRP by injection versus PRP with microneedling, I think of microneedling as a method that is designed more to help epidermal and dermal wound remodeling. So it works very well for fine lines and wrinkles around the eyes. It works very well for acne scars. And we use PRP with microneedling routinely. But when it comes to hair loss, my concern with aggressive microneedling is that you can potentially cause inflammation of the glands that are associated with the hair follicles, as well as you may traumatize the hair follicle themselves, depending on the depth, but at a minimum you may be traumatizing the hair shaft and the elements of the hair that are more superficial. So you have to be mindful of that. The rationale, I think, is that if you microneedle and you apply the PRP, you get a nice uniform absorption. And I certainly believe in that when it comes to skin rejuvenation, for the rejuvenation of wrinkles and sun damage. But I would say that if you had to make a choice, I would say the injection has an advantage. In terms of your own healing process, it's actually easier to heal from the injections versus the microneedling because you don't have any rawness to the surface. Now, typically 24, 48 hours, microneedling injuries can actually heal up pretty well. But again, putting aside your question about one versus the other, I would say that you have an opportunity now to learn about the technology and the work that is behind hair regeneration, which is PRP with acellular matrix and a protocol that has been very successful. So I hope that was helpful. I wish you the best of luck, and thank you for your question.